All right, good afternoon. Thank you for attending my talk. I am a postdoctoral research fellow here from the Vanderbilt Institute for Global Health in the United States, and I'm here working on a project under the guidance of Professor Lloyd Malenga here at UTH. My project is titled Feasibility and Acceptability of Implementing HIV Testing in Combination with Routine HPV Vaccination in School Health Programs. Just to give some background on this project, as some people here might already know, cervical cancer, which is caused by human papillomavirus or HPV infection, is currently the most common cancer in Zambian women. And also, women with HIV are 5 times more likely to develop invasive cervical cancer after HPV infection. So given the close association between HPV and HIV, the school-based HPV immunization campaign that was initiated here in 2019, we feel offers an opportunity to simultaneously provide HIV testing services for adolescents who are an often hard to reach segment of the population. However, since the age of consent for HIV testing is currently at 16 years old, this has hindered efforts to implement combination HIV and HPV programs, since the HPV vaccine is currently targeted to 14-year-old girls. So there's a discrepancy there, there's a gap between the ages that would be targeted by these programs. And of course, knowing one's HIV status as soon as possible in life, particularly before sexual debut, is something that can allow appropriate care or prevention efforts to be initiated as soon as possible, which can be beneficial. So the bottom line here is that the purpose of this study was to evaluate public opinion and policy regarding 2 different things. First, the lowering of age of consent for HIV testing, and second, regarding implementing HIV testing in schools in combination with HPV vaccination. So there were 3 main goals to this project that are broken down here on this slide. There's a significant need for healthcare interventions aimed at helping young adolescents to know their HIV status and empowering them to make use of prevention and treatment options for HIV and HPV. So the first goal of this project was to evaluate community readiness and sociocultural factors that would influence acceptance of lowering the age of consent for HIV testing and acceptance of implementing a combined HIV testing and HPV vaccination program in schools. Secondarily, we wanted to assess the readiness of the health system and any logistical challenges that might be faced in implementing this combination program. And then the third goal was to evaluate the readiness of existing health and education policies, chiefly willingness to lower the age of consent for HIV testing among policymakers in order to design an advocacy strategy to generate support among government officials for this combination program. Broken down another way, these are some research questions that we were hoping to address during the course of this project. First, what level of understanding does the community, namely students, parents, and teachers, have regarding HPV vaccination, HIV testing, and the links between HIV, HPV, and cervical cancer? Second, how do adolescents and their parents feel about increasing access to routine HIV testing at a younger age and combining it with HPV immunization? Third, what challenges would teachers, school administrators, doctors, and health workers expect to face when implementing HIV testing in combination with HPV vaccination? And finally, are government officials willing to advocate for implementation of these changes? If so, what avenues would be effective and what challenges are expected? So this was a qualitative research study done using qualitative methods. Namely, we made use of interviews, one-on-one interviews with various groups such as school administrators, health facility administrators, and officials in the ministries of health and education. And then small focus group discussions of 5 to 10 participants drawn from students, parents, teachers, and healthcare workers in the community. The purpose of this being to gain insight into the views, opinions, and ideas of key stakeholders. And the study sites that we worked at were schools and health facilities located in Lusaka and Kafue, as well as the government ministries. Recruitment was done using a combination of purposive and convenient sampling. And data collection was done by recording audio from the interviews and focus groups and then transcribing it for coding and thematic analysis. In addition, an anonymous survey was administered to parents and students to get some baseline demographic information. So the results of these surveys are shown here. We had 94 parent respondents and 99 student respondents. Among parents, the majority ended up being female, 77% were female participants. The mean age was 40 years old, and 95% of parents, the majority of them, reported having previously received an HIV test. Conversely, for students, there was a more even 50-50 split between the female and male students who participated, with a mean age of 14 years. And 28% of students reported having previously received an HIV test. And among the female students, 36% reported having received at least one dose of the HPV vaccine. So data analysis from this project is currently ongoing, but so far we have some preliminary results that have drawn out some common themes among the ideas that were expressed to us by the participants. Chiefly among these were opinions on the age of consent for HIV testing. Many participants were in support of the idea of lowering it below 16. Suggestions that we received ranged anywhere from 10 to 14 years old being an appropriate age for children to be able to get an HIV test without seeking consent from their parents. However, there were people who were of the opinion that the age of consent should remain at 16 or even be raised to be higher. And some people expressed to us that they felt that the current laws and policies that are in place don't clearly define what the age of consent is for HIV testing, or that it's not well established. Many people also spoke to us about their thoughts on the maturity of children with regards to getting an HIV test. Many people who felt the age should not be changed felt that way because they think children are not mature enough to ask for an HIV test or to accept the results until they're at least 16 years old. Conversely, people who felt the age should be lower, their rationale was that children today are maturing more quickly and engaging in risky behaviors at an earlier age, particularly because they're being exposed to mature topics sooner due to increased availability of information and social media use. Regarding the understanding of these infections among people in the communities, it became apparent that HPV as an infectious disease is fairly poorly understood. Mechanisms of transmission were largely unknown, and there was some mistrust of the vaccine. And it was mentioned to us that, in particular this year with the rollout of the COVID vaccine, that may have increased mistrust of the HPV vaccine itself. There were also some persistent misconceptions that arose about the modes of HIV transmission among our participants, and notably fear was a commonly cited emotion as a reason to avoid HIV testing. We also received suggestions from our participants about ways to improve understanding of these infections among the communities. Chiefly among these suggestions were that health education efforts should involve the whole family holistically, including both parents and children. And it should take place where communities congregate. One suggestion that we received was to have it take place in the markets. We also received suggestions that there's a need for improved health education regarding HIV and HPV, especially for the teachers. It was expressed to us that because teachers are the ones who pass that information on to their students, and then students might pass that information on to their parents at home, that it's really important for teachers to be well equipped to share correct information, since they're the first point of contact in that chain of information being passed on. And then finally, it was really emphasized to us that if HIV testing services are to be provided in schools, that strong trauma counseling capabilities are going to be really paramount to accompany that. So just to conclude, as I mentioned, data analysis is ongoing. So this is just some preliminary recommendations that we've been able to draw from the information we received. I can recommend increasing sensitization of both parents and children in order to improve acceptance and decision-making regarding HIV testing and HPV vaccination. Also, to support collaboration between policymakers and the teachers and healthcare workers who are often the ones administering these programs, that they should be involved in designing and implementing them as well. And then, as I mentioned, improving the education of teachers as well as healthcare workers to counteract misinformation among the communities. And finally, strengthening training for counselors to support adolescents with HIV. And just to wrap this up with a couple of limitations to mention for the study, it was a qualitative study with a small sample size that's not necessarily going to be representative of the entire country. The majority of parents that participated were women, which could skew some of the opinions that we received. It could also be skewed by the fact that we used convenience sampling. So there might be other groups of people who have very different opinions. And then we didn't have any interaction with tribal chiefs or traditional healers, which were mentioned to us as groups that would be really important to interface with in the future if this were to be a program that gets implemented. So thank you for your time, and I'll be happy to take any questions.